Management. Today we're going to welcome Celinda and Megan, so they're going to go ahead and get started and enjoy. Thank you. Feel free to ask any questions in the chat.
Okay, hello, and thank you for joining us on this very cold afternoon for our January Community Enrichment presentation. Our focus today is mental wellness. We are going to talk about moving from diagnosis to balance and finding strategies for mental health and well-being in complex medical journeys. Next slide, please. Celinda and I would like to take a moment to introduce ourselves so that you have just a bit of information about your presenters for today. My name is Megan Bazzett. Prior to joining the Coordinating Center in 2022 as the director of our Community First programs, I spent just over 20 years in the community-based mental health field. Our Community First Programs Division works with the Maryland Department of Health's Office of Long-Term Services and Supports to provide supports planning services to individuals living across Maryland. Supports planning is a person-centered level of care, and it links people who meet certain medical, technical, and financial eligibility criteria to different resources and services that are designed to meet their needs and the environment of their choice. These services can range from home modifications such as ramps to increase accessibility to accessing other durable medical equipment or home-delivered meals.
And good afternoon. I'm Celinda Carr, and I'm a social worker and certified case manager, and I've worked at the Coordinating Center for almost 13 years. For the past 5 years, I've been the program director for the Rare and Expensive Case Management Program, more commonly known as the REM program. And REM provides medical care coordination to over 4,000 Maryland Medicaid recipients who are living with specific medical conditions. We have almost 80 clinical care coordinators who are licensed nurses and social workers, and they assist our clients every day as well as their caregivers. And sometimes those services include linking them to new providers, facilitating getting medical equipment or supplies, assisting with a medication authorization or refill, and referrals to an assortment of community resources.
Thank you, Celinda. Today's topic is one that Celinda and I are both passionate about and look forward to speaking on. Next slide, please. Okay, we have a few pieces of housekeeping that we'd like to go over with you before we get started. We will be recording the presentation, but will not record the Q&A. Please remain on mute during the presentation. Please use the chat to submit questions, which we will then address during our question and answer session. We ask that this remain a safe space. If any personal information or opinions are shared, please just keep it within this group. Please go ahead and silence your cell phones. And finally, slides, documents, and unanswered questions will be emailed. Next slide, please. And just a disclaimer before we begin that this webinar is intended for informational purposes only. It is not a substitute for professional advice. Next slide, please. We're going to take just a moment to go over our learning objectives for today. We would like for you to walk away from this session with an understanding of mental wellness, both its importance and how significantly the management of a complex health diagnosis can impact mental wellness. We would like for everyone to gain an understanding of this impact from the perspective of different roles and also to walk away with tangible resources and tools. Next slide, please. Okay, let's go ahead and dive in. So again, we're so happy to welcome each of you here today to talk a bit more about complex health conditions and the impact that they can have on our mental well-being. Some of you may recognize January as Mental Wellness Month. Slightly different versions of mental health recognition dates are celebrated throughout the year, and there's usually a big focus on Mental Health Awareness Month in May. However, we really wanted to bring everyone together after the holiday season to focus on mental wellness. While January can bring a bit of a letdown period for some, it can also be a really great opportunity to incorporate fresh strategies into daily activities as we start the new year. So what exactly does this term mental wellness mean? Well, the definition can vary a little bit from one source to the next, but essentially when we refer to mental wellness, we are talking about how we are doing with all of the challenges that life has thrown our way. Next slide, please. As informed by the World Health Organization, we can describe mental wellness as a state of well-being in which one understands their abilities, can cope with the normal stresses of life, and work or engage in meaningful activity to contribute to their community. Next slide, please.
So we'll go ahead and take a closer look at the impact that complex health conditions can have on our mental well-being. And we're going to explore this from the perspective of a few different roles. And those roles are one of being the patient, the caregiver or advocate, and also a member of the healthcare team. So some of you on this call may know all too well what it's like to manage a complex health diagnosis from the perspective of one or maybe even all of the roles that we'll cover. Next slide. We wanted to begin by sharing some information that shows just how closely linked chronic health conditions can be with one's mental wellness. And so the figures on this slide are from the Mental Health America. Of the individuals who took part in a screening at mhascreening.org, those who listed chronic health conditions were either positive for or at risk for mental health conditions. That's per their own reports. And so we can see that 75% of individuals living with heart disease were either positive for or at risk for also living with a mental health diagnosis. For individuals living with cancer, 73%, 74% for those with diabetes, 79% for those living with chronic pain, and 80% of folks living with COPD were either positive for or at risk for also having a mental health diagnosis. Next slide, please. This slide then provides some statistics that are specific to the frequency that major depressive disorder is seen in various chronic diagnoses. With major depressive disorder, there are a range of symptoms that might include, but not limited to, feelings of sadness, emptiness, or loneliness that you just can't shake. Decreased interest in activities, changes in sleep or weight that are not attributed to a medical condition, fatigue, feelings of worthlessness, decreased concentration, recurrent thoughts of death, or thoughts of suicide. And as you can see from the data on this slide, major depressive disorder, which is just one category of a mental health diagnosis, occurs at a fairly high rate when each of these chronic health diagnoses listed are in play. The 73% related to a cancer diagnosis is the one that I found really astounding. Next slide, please. So why do we see such high rates of mental health conditions overlapping with chronic health conditions? The National Institute of Mental Health, or NIMH, identified 4 triggers for depression, all of which can be associated with a complex health condition. The first is a family history of depression. Next could be changes in the brain related to that chronic disease. Third is medications that an individual could be using to treat that chronic disease. And lastly, periods of stress or anxiety that are brought about by a chronic disease. And I'd like to focus a little more on that last factor of anxiety, because depression is not the only mental health diagnosis that commonly occurs for individuals living with complex health conditions. So next slide, please. Anxiety can occur when an individual is perceiving a threat in the future and their own inability to predict or control the outcome of that situation. So people who have anxiety disorders struggle greatly with uncontrollable feelings of fear, worry, and panic. And this can lead to feeling physical symptoms like restlessness, fatigue, muscle tension, hyperarousal, and sleep disturbances. And as distressing as that all sounds, anxiety does serve a purpose for all of us. You can have anxious feelings, and while they're uncomfortable, they tell us, they're sort of that warning sign that something in the future could harm us, and that often motivates us to act. we sometimes need to think about anxiety as a set of alarm bells. So if there's a fire, you want those alarm bells to go off. And for most of us, that anxious feeling passes whenever that thing or situation that we're nervous about passes. For other people, though, those alarm bells keep ringing, even when there's no fire, no danger, or anything that requires them to be quick thinking, fast acting, or make a big decision. And when that happens, it can really be all encompassing. It impacts all of that individual's social and occupational functioning. And this is the point that things cross the line to be considered an anxiety disorder. Next slide, please, and I'll toss it back to Megan.
Thanks, Celinda. So we've talked a bit in general terms about how the weight of managing a complex health diagnosis can impact people. Now we're going to transition to a closer look at how this journey might look from one role to the next. We're also going to discuss some ways to maintain mental wellness and to find balance within each of the roles. Next slide, please. Okay, let's first take a look at how mental wellness can be maintained by the person who is experiencing firsthand what it is like to live with and to manage one or more complex medical conditions. It's important to acknowledge right from the start that each person's journey is completely unique and that the uniqueness is shaped by several factors. Let's start with the age of onset and nature of the complex health condition or conditions. This is perhaps one of the biggest differentiating factors. Some individuals may be managing a complex health condition from birth, while others experience an onset later in life. Some complex health conditions may impact many or all parts of a person's life, while others have a more limited impact. There's also variability in the level of care that's needed, as well as in the prognosis. And each of these differences can significantly change the course of one person's journey. Another factor to consider is the presence of a natural support system. Having friends and family to provide that support versus not having friends and family. Even having friends and family who live close by versus having friends and family who live further away can really make a significant difference. Finally, and I say finally, but this list is certainly not meant to be exhaustive. Finally, we consider access to resources. Resources to one individual may mean having a computer available to join a virtual support group or having a vehicle to be able to drive to a doctor's appointment. To another individual, though, resources may be food, shelter, or clothing. For those of you who are familiar with Maslow's hierarchy of needs, we know that it's really difficult to find stabilization in other parts of life if our basic needs aren't met. The point is that each of these items listed changes and shapes someone's unique journey. By providing many options for resources and tools to support wellness, we are likely to meet more people where they are in their journey. We'll get into those tools in just a moment. Next slide, please. Okay, before we talk about tools and action steps, let's touch briefly on recognizing the signs that our mental wellness might be compromised. These are a bit of a recap from our earlier slides on depression and anxiety. And we're talking about increased sadness, crying, or isolation, lack of interest or pleasure in activities, and especially if they once brought you joy. Experiencing passive thoughts of death or actively planning to end your life. An excessive worry, fear, or feelings of panic. Now, just as many of the lists that we're touching on today are not meant to be exhaustive, the same applies here. If you do not feel well, and even if the signs don't align with the lists on the screen, you want to seek help. Your primary care physician is a great place to start if you're unsure where to begin, and that's a good place for us to transition to our step of taking action. Next slide, please. Okay, again, there are many different ways to take action, and we're going to go through just a few. So seeking additional support. We just mentioned going through your PCP, but really any healthcare provider should be able to hear your concerns and offer resources for further evaluation or support. Another option is to contact a mental health provider directly. There are many different options ranging from medication management to therapy and more. Also included in this conversation of additional supports is a tremendous benefit that some people find in joining a support group. And there are support groups that are specific to managing depression or anxiety, and there are also support groups that are specific to managing the complex health diagnosis. Okay, the next point on our slide is the reminder that there is power in knowledge. So you want to seek as much information as possible about the complex health condition after the diagnosis. As scary as it can be to learn that you're living with a complex health condition, all of the unknowns about it can sometimes make that journey even more frightening. And next, we want to focus on compiling a wellness toolkit. Each of us may want to include different things in our toolkit. This could be anything from mindfulness activities, recipes to focus on healthy eating, contact info for support groups and mental health care providers. It could include positive affirmations, community resources, tips on staying connected with others. We're going to include a really wonderful link from the National Institutes of Health for an emotional wellness toolkit in our resources today. And we're also going to take a quick look together now, and I'm going to give a huge thank you to Heidi for helping us to navigate this. You can see on your screen there are 6 different strategy cards that NIH provides for improving emotional health. And each one's represented by a card that you can click on to flip. Once you flip, there are different checklists, images, and articles that you can use to support your emotional wellness in each area. It's really a great resource, and I would encourage everyone to take a look if you have the chance. Okay, finally, one additional action step that you can take, and of course it's easier said than done, but really try to focus on the positive. Don't lose sight of all the wonderful abilities that you do still have. Next slide, please. Okay, we're going to talk now about maintaining mental wellness and finding balance from the perspective of the caregiver. And for the purposes of today's conversation, when we talk about a caregiver, we are referencing not only the individuals who might provide care for someone managing a complex health diagnosis, but also those individuals who care about that person. So for many, this might include close family members or friends. It's important for us to remember that the journey of each caregiver is unique as well. The nature of the relationship and the type of complex health condition that the person we care for is living with, both help to shape that journey. Sometimes the caregiver focuses so much on the act of providing care that they don't recognize the physical and emotional toll that it can take. The worry alone really could make it a role that many caregivers find themselves in around the clock. This makes it really, really especially important to recognize the need for balance. It's such an important part to maintaining mental wellness. Next slide, please. Okay, let's touch now on just a few things that caregivers can do in order to find this balance. First, please remember that it's absolutely okay to take a break. In fact, it's not only needed, but it's really necessary to give yourself that opportunity to recharge. I want to circle back to something that we touched on briefly in the beginning, and that's the idea that many people on this call may find themselves in multiple roles as some combination of a patient, caregiver, and care team member. Taking a break, regardless of your role, is going to be vital. Next, establish a network of supports. Perhaps this is in the form of other care providers who assist in your absence, a friend who can lend an ear, or maybe it's joining a formal support group. Whatever your network looks like, please take care to build those supports that you can turn to, not only to lean on in the difficult times, but also people who you can celebrate with in good times. And then finally, give yourself grace. It is hard to see someone you care for manage the struggles that can accompany a complex health diagnosis. There's not a perfect way to care for somebody. We just do our best each day. Okay. Next slide, please. And back to Celinda.
Thanks, Megan. We're going to start talking about finding balance as a care team member. And a care team member in this context refers to anybody who might be working with an individual in a professional capacity, and that can positively impact their journey of managing that complex health diagnosis. So this could be a clinical care coordinator, a case manager, a supports planner, a coordinator of community services, a nurse, a physician, a therapist, or even a personal care attendant, just to name several of them. And just as it's important that the patient and the caregiver find balance and mental wellness, it is incredibly important that the care team member does as well. When that care team member finds this balance and has mental wellness, we see outcomes such as improved job performance, increased job satisfaction, and reduced burnout. And burnout it's real. I found some statistics from Mental Health America when we were preparing for this, and they cited that during the pandemic, 8 out of 10 people experienced signs of burnout. The number of suicides rose for the first time in several years, and the number of people with depressive symptoms tripled. So we must be care team members who are engaged in mental wellness activities. Next slide, Heidi. So let's touch on a few ways that we can achieve balance as care team members. And by no means is this meant to be an exhaustive list, but we'll start with the importance of establishing and maintaining boundaries between our work lives and our personal lives. As I'm sure many of you in this webinar would agree, most people who work in the human services field or medical professions do so because they want to help others. And that desire to help someone in need doesn't just stop at 5 o'clock each day. So sometimes it can be difficult to establish those work-life boundaries. And we have to remember that doing that doesn't mean that we care any less for our clients or our patients. Establishing those boundaries is actually going to give us the chance to recharge so that we can come back day after day and provide services that are as good as they can possibly be. So, of course, depending on your role within your organization, your ability to do that might vary, but some suggestions would be to have a stop time when you no longer take phone calls or emails in the evenings. Perhaps refrain from bleeding your work and personal life on social media. Just a couple of suggestions. Next on our list is gratitude and mindfulness. And gratitude can really be a game changer because it's all about taking notice and appreciating the little things in life. And doing that can increase your happiness and your well-being, your life satisfaction, and even overall health while decreasing all that stuff that we want less of, like anxiety and depression and anger. It is truly difficult to really tap into gratitude and also get stuck in negativity. So if you find yourself or a coworker getting wrapped up in negative thoughts or starting down a spiral, find something in that moment to be grateful for. And in doing that, you're combating that negative content in your thoughts and bringing your mind into the present. That being said, I also need you to be mindful that gratitude doesn't become fuel for guilt. So that kind of happens when your mind uses gratitude to minimize your painful experiences. And that could go something like, I don't have a right to be sad. I have so much to be grateful for. What's wrong with me? Sentiments like that take your gratitude, which should be positive and uplifting, and turn it into something that you're beating yourself up about. And that resulting guilt is not necessary. It doesn't serve any purpose. So be clear that anxiety and depression are not the result of you being ungrateful. Rather, gratitude is a tool to add to your toolbox as a helper. The next things on the list are making a difference and celebrating good news. There's a quote I keep on my desk and it says, never underestimate the difference you made and the lives you touched. When you know you've made a difference, share that with your peers, your coworkers, your supervisor. Make it a teachable moment for everybody. You never know how much further your difference can go, so celebrate it. Celebrate all the good news. We all need that boost and a smile. And finally, engage in professional development opportunities. Take advantage of what your organization offers as far as continuing education. The fact that you're here today is wonderful. Learn more about your client's diagnosis and their mental wellness. And overall, what we'd like everyone on this webinar to remember is taking care of your mental health is just as important as managing medical conditions. By staying informed, practicing self-care, and finding the right support, you can navigate challenges more effectively. So please keep these strategies in mind and remember that you are not alone in this journey. Next slide. In addition to someone's care team, there are also local and national resources available to anyone. 988 can be called whenever you need emergency emotional support or are worried about someone else. The 988 helpline is free and it's confidential. The call or the text that you send will be answered quickly by specialized counselors who will treat you with understanding and dignity. The link that we have for mentalhealthamerica.net, it has mental health tests that anyone can take. They're quick questions to determine if someone is trending toward depression, anxiety, an eating disorder, bipolar disorder. There's lots of different subject matters, and they have those tests in both English and Spanish. Their website, actually, it's always kept up to date. Right now, in light of the recent wildfires in the Los Angeles area, their homepage is dedicated to offering mental health resources during times of disasters. And of course, anytime you or someone you're caring for needs immediate help, 911 is always a resource. Next slide, please. So Megan and I appreciate the time you've spent with us today, and we've listed here some additional references used in the preparation of today's presentation. That one at the very bottom, the Emotional Wellness Toolkit, is the one that we link to through the National Institute of Health if you're looking for those flip cards that have really good information. And for now, we're going to stop the recording and be open to answer any questions you have or comments you have on our presentation today. Thank you.